Hey friends, it's Kristen from Action Potential, and I just wanted to share with you one of my favorite aspects of physical therapy, which is the treatment of pelvic floor dysfunction. A lot of people don't really realize that that's an area that physical therapists treat, but certainly it's something that at Action Potential we pride ourselves on doing for both men and female patients. And just to understand a little bit more about what pelvic floor dysfunction is, it can present itself in a variety of different ways, whether that's pelvic pain, incontinence, or any type of issues with bowel or bladder function, and often can come as the result of something like an abdominal surgery, maybe a prostate surgery, pelvic surgery, childbearing, or can just naturally occur as we get older and some of our structures start to weaken. When you are interested in pelvic health physical therapy, you would come into the clinic and we would do a full evaluation of your pelvic floor function. That would include an external examination of your posture and muscle strength, as well as potentially an internal examination of the pelvic floor, which would allow us to access the muscles of the pelvic floor internally to determine if there's any issues with tightness or weakness that may be limiting your function. Certainly, when you come in, we would explain the process of how that examination would take place, and based on the results of those findings, we would customize a plan to address your issue by using a variety of techniques that could include things like massage, muscle release, muscle strengthening, or activity modification to help you get back to the things that you love. So certainly if you have other questions in regards to pelvic health physical therapy, please check out our website, and under the services section, you'll find a wonderful page with lots of resources on pelvic health physical therapy. And certainly reach out via email or social if you have any questions, and we'll be happy to answer those for you. Thanks so much.